Thanks so much. And maybe I can just sort of pass out. We get questions from people who are not in the obvious priority groups, but who feel very, very anxious. And these include people who are under 60, but have chronic conditions who are immunocompromised in one way or another. They include teachers of children in daycare who, the kids aren't wearing masks. We don't really know what the kids are carrying. We know that generally kids are, carry all sorts of stuff. Kids carry stuff. So daycare folks are scared. And then also, people who just are working on front lines, dealing with lots of people, particularly when we don't have paid sick days available. And we know folks are working when they're sick because they can't afford to not to, or they're afraid they'll lose their housing. So people who are working frontline, on the front line, or who are essential workers, and those especially who are working with marginalized populations, all of those folks are not sort of scheduled for priority, but are really concerned. What are your thoughts about how they should deal with this? Thanks.
Maybe I can start answering, and then my colleagues will pick it up. Actually, there is a lot of advocacy already has been put in place to prioritize, to push further for frontline workers, including teachers. And as of last Friday, the provincial regulations have been changed, so the dates and populations included in each stage of vaccination have been changed already. And we can see, if we go on the provincial website, those second phase already lists frontline essential workers, including teachers, which would include teachers of the child and daycare centers, as well as food processing industry. When exact in the second phase it's gonna happen, again, it's not quite clear, as not more details, more refining are coming up from the province in terms of the details, who and when. But again, we just on the Toronto Public Health side and on the community health clinics, we still getting ready to deliver as soon as possible. Thank you.
I wonder if I can add just a little bit of a follow-up to that question. I think one of the challenges is that despite all of our best efforts, there's a finite supply of vaccines. And what that means is that there is an opportunity cost. If I offer a vaccine to one person, it necessarily means that I can't offer that vaccine to someone else. We are very much focused on equitable distribution of the vaccines, and we are trying to use science as much as we can. Recognizing that, even despite our best efforts, we will not be able to vaccinate immediately all of the individuals who are and consider themselves to be the highest risk. And I think that really speaks to the importance of having leaders like yourself, like our members of provincial parliament who have organized this today, to help us navigate with the comprehensive policy approach that includes important things like paid sick days, increased Ministry of Labor investigations, enforcement of rules. I can say, addressing some of the individual concerns that I saw in the chat, such as, around children and teachers. Within our own community, Michael Garron Hospital has been working extremely hard to try and make our school system as safe as possible. So we are beginning to introduce rapid testing for students, take-home COVID testing kits. We're trying to remove as many barriers as possible so that we can rapidly and immediately identify any individuals who could put our teachers, our daycare workers at risk. And we're trying to apply that holistic approach to a comprehensive community safety while we wait to have enough vaccines to get this out to everybody. So we're not in a, it's a less than ideal scenario, but we have to attack it from as many different perspectives as possible. I think our leaders here are doing that. And certainly your community hospital as your partner is doing everything that it can to support those initiatives as well.